Good afternoon. This is the Board of Health monthly meeting, and today is November 3rd, Thursday, November 3rd, and it is now 4:31. We are having our board meeting, and I'm transition to Dr. Brophy, chairperson, to open the meeting.
So I'd like to call the meeting of the Board of Health for the month of November order. So first item on the agenda is the approval of the minutes from the October meeting. Mr. Fisk, any edits or changes to the meeting?
None that I could see. I accept it as read. Yep.
Accept as read. I second. All in favor?
Aye.
Aye. Next is the Life Science Bio-Ready Community adoption of the NIH guidelines. Is Mr. May on today or?
No, they're not in today.
Okay.
I think what we were looking at is to actually make some headways in a conversation with the other municipalities that have welcomed this technology.
Right.
And so therefore, I was not able to reach out to them yet to set an appointment. So I think this is next step for us at the Board of Health to reach out to identify some of those municipalities, the person who would be able to elaborate a little bit more with us to see how we can learn from their from them instead of reinventing their wheel.
Yeah, I think there's some committees too as well that that the city will have to have in place for this to take place, and then the guidelines as to how companies that are opening the process for being approved, and then also the follow up on making sure that they're following guidelines, etc. So we'll plan hopefully by next month to have some feedback from those communities, as well as some guidance from Mr. May, who's been working very hard on this. And I think we have a lot of the discussion that we had. We had a lot of information about these, and I think we're on track. I think here to move forward with this. So great. So thank you.
Great.
Okay. So next item on the agenda is just the notification that the notice that the board voted to deny the request for the tobacco license to a new tobacco permit to the it was a 7-Eleven convenience store on Belmont Street. So a notification has been sent to the
Just so that they know they weren't singled out or anything. It's
Right.
it's a rule that we've had for a few years.
Yes.
So it's not that they were singled out or anything like that.
Right. Okay. Next item on the agenda is the latest statistics on COVID. So maybe you could walk through sort of what the dashboard's showing, this, the wastewater, etc., and cases in the city. Where we stand right now.
Thank you. The latest print out, which comes every morning, basically. So when we send out the notice, the agenda item, we are a little bit behind,
Right.
By about 7 or 8 days, because the meeting was the agenda was submitted and posted a week to today. So today's start is 12 new cases within the last 24 hours, and then total active cases 129.
Okay.
Total death has dropped from 507 to 506. Now, this is something that happens almost on a regular basis with DPH as they reconsider or revisit the pathology of each disease case. Therefore, they decide, okay, whether this case was COVID related or non-COVID related. So therefore, they have dropped it. They have removed another case, bringing us down to 506. And the total cases to date cumulatively is 32,916. For the first time since we've started collecting wastewater data that we see it drop below 1 million copies
Yes.
per liter of water. I would say in a way that could be a good sign. And I think we look at across the nation, there is a drop also almost in most parts of the country. So whether or not this is a wrong or a false assurance, but the numbers have dropped. The numbers in the hospitalization kind of fluctuates up and down depending on the day. So we continue to observe the modality or the tendency of the rate. One thing I would add is that the positive rate is 7% among the population. So we still have a way to go because 7% is considered still high.
Right. And that 7% is probably an underestimation because people home test and stay home. And so only the tests that get reported to the Department of Public Health are showing up, or that we're aware of people who test at home and are positive and are treated at home or don't require treatment. They're not showing up on this. So we still, we're still high, but it's not going up as we were for quite a time. The only worry now is that we're going into the fall, the people moving inside, and so caution again. And inside is your highest risk with exposure. When you're outside, you're pretty safe outside, but it's really inside. So, and as the holidays approach with people traveling and so forth, so we don't know, but there's always a worry that as the fall goes into the holiday season, people traveling and with the moving indoors, that we may see another spike again. But so people to continue, to be caught based on your risk and family risk, et cetera, to keep in mind that those risks are there and to act accordingly.
Yes.
Yep. Okay. All right. Great. So how about the vaccinations? So you were gonna.
Yeah. The vaccination is going. We have great demand for it. We do both flu and COVID vaccination. Today, the nurses were at the Cape Verdean Association, which is on Montello.
Yeah.
Yesterday, they were at the Shaw Center. They did 25 flu cases and 26 COVID cases. So that was a good number, 51 cases altogether that they did. So we have ongoing cases. So there is something that we have also added to it. We have a list of seniors or veterans who are people who are at home, who are homebound. So they called to ask if they could get vaccinated at home. So the protocol as of now is that the nurses will do vaccination at home for them every other Thursday. Okay. Yeah, so I know the demand is high because we have clinics here and there all the time, but we add this to our agenda so that we'll be able to reach out and vaccinate those seniors or those individuals who are home, who are bound at home.
Do you have the staff to meet the demand? Is the demand high or?
Well, we try to find a way to manage with the staff that we have because we're trying to be fiscally responsible as well. We do have 2 other nurses per diem. They join us whenever we call them. They vaccinate for us, but we are watching the finance part of it very closely so that we don't go over our budget.
Right. So you're as the demand rises, you bring people in to help, keeping in mind.
Yes. So, and then this year we have a significant number of flu vaccination, And so far, I would say that so far, for the past 2 years, we have exceeded. Looking at this flu season compared to the last two seasons, we have already exceeded almost the entire two other seasons. And so DPH has been very receptive in giving us more vaccine. So
Okay, good.
that's an excellent time for us to get people vaccinated also. One piece of news that I wish I didn't have to say, it's the company that has been doing PCR testing for us at the Shaw Center, Curative Inc. For the entire month of October, they have only vaccinated 23. They have only tested 23 people. And so I had a very long conversation with the regional manager this week. I think Tuesday we had that conversation, and the conversation was around the demand of testing across the country. And so it seemed that there is a national drop in people wanting to get tested that way. And so Curative has reached a decision. They didn't really include us per se, but they sent us a letter, a termination letter, stating that next week, Thursday, will be the last day at the Shaw Center. And what I was also informed of is that they're not only closing the site here in Brockton, but they are closing many other sites across New England and across the country. So I guess it will be a loss for now, but people can look elsewhere if they want to get tested with PCR. I think they could get that test either at the pharmacies or at the the hospitals as well. But we will not have a regional site for PCR beyond next Thursday.
So they're still doing it in the pharmacies, etc. in the area.
Yes. Correct.
Is there any other center around in the area that you're aware of that's still open, or is it?
I don't know right now if there is any, because DPH has closed down most of the site as well. And so I would have to look at and inquire to see if there are any other sites where people can easily go and get tested. Yeah.
So, and do you keep that information on the webpage for the public to be aware of? So you'll announce that the testing at the center will close and the testing.
It's not posted yet because the final decisions. I informed the mayor once I get the final information. So the law department sent a letter, reply letter to Curative, stating that they have received their the letter, and so I think we will bring that to the attention of the public so that they'll be aware of that.
Can I ask, is the community health center still testing with PCR or something?
They don't do it on a regular basis. I think maybe if some patients, if there's a need for them to do that. Because they have a lot of their patients also receive home test kits.
Right.
Yeah. So there is a drop also in the number of tests they do at the health center.
Yeah. Well, the demand, with the travel thing, the PCR used to be needed for various travel, but since those restrictions have been dropped, I think there's a lot less PCR testing, except when you're in the healthcare system where they confirm Binex or a home test being positive. So
yes. Also, I must say that with respect to vaccination, I was asked a question at the this week if the regional vaccination site will remain open, because the nurses, the Board of Health nurses, as well as booster ambulance have been vaccinating at the Shaw Center. Now, the clinic that booster vaccinates or manages is quote unquote original vaccination site. It is underwritten by DPH. So the answer is that we don't know yet. We do know that next year, next January, we will have a new governor, a new lieutenant governor. So there will be a new administration that may impact the decisions. But right now, the Baker Polito administration with DPH seem to not put a firm date to close. Originally, they envisioned the end of December as a possible date to close the regional vaccination site, but right now there is none. Yes.
Great. We should encourage people also to get vaccinated, or not just the COVID, which is now all of the boosters that are out there are against the Omicron, the more prevalent variant. And the other thing is that we are expecting at least in other parts of the world with the southern hemisphere, flu rebounded very rapidly, and it's been very high. So we are expecting it could be a very high incidence of flu this year, and we know right now that the flu vaccine is very effective against this strain of the flu. It seems to be a very effective vaccine. So encouraging people again to get vaccinated against the flu moving forward. So.
Yes. Also, I might add that as a way to encourage the public to get vaccinated, DPH has also extended or has initiated a program to get people vaccinated. They offer $75 gift cards to any individual, not family, to any individuals who get either the primary series, meaning monovalent, first dose, second dose of Pfizer or Moderna or any vaccine considered first series, as well as people who get the booster doses or bivalent. So anybody can get that, but one caveat is that individuals need to look at the city where they live. Say people living in Brockton, they could easily view our sites on the website. So DPH has a site where wherever people live in Massachusetts, they can look to see where those sites are, and then they can go and get vaccinated. Because the reason I specify as such is because I don't believe that the pharmacies, like or any pharmacies for that matter, have access to those gift cards.
Okay. So if you're vaccinated at one of the DPH clinics. Okay.
Yes.
Yeah. Okay.
Mhm.
Any questions?
Nothing here.
Okay, great. All right. So I think we've gone through most of the COVID information for the city. And how about the any updates on the health promotion and health education?
We push this, and we have made some progress with our partners because we continue to work together with them. The group of clergy, now for the clergy, there are two particular meetings that they have with the mayor. One is on a Wednesday, every other Friday, and then one is on Wednesday. So we have seen a decline in the numbers, but we continue to offer vaccines to them or any other service that they need to help mitigate COVID in the congregation. And also we continue to work with many other city departments, such as Council on Aging. We've been there quite often and we get high numbers. We work also with Massachusetts Community College. And so with all these agencies or organizations, we have taken notice that at times the number of people getting vaccinated increase.
And is there any other activity going on outside of COVID, like the homelessness and other issues within the city?
This is an issue that we address on a regional level because Board of Health Brockton is a member of the regional coalition of local boards of health, and so we address it. Now it's a little bit difficult to address because some municipalities look beyond just the surface. They go a little deeper to find the root causes of homelessness. And that requires a deeper understanding and commitment on the part of each municipality to address it. So, and it is not just a localized issue. So therefore, we are addressing it as a group and to see how we can really bring to light the best way to tackle it and find a solution to that. But we're not there yet. We're still the topic is still under discussion.
Yeah, with the winter months coming now, this is an important issue because I don't know how much of how well the shelters are holding up or having enough beds, etc. in the city. It'd probably be worthwhile something as we head into the winter for the department to pay attention to, because I know it's been an issue in the city and situation is it will get worse probably during this time period.
Yes, certainly,
Yeah.
certainly.
Mr. Fisk, any questions on your part?
Nothing here. No.
Okay, great. And then you continue to work with the mental health.
Yes, we'll continue to work because I think this is an area where, as much as I can, I will continue to work because we've mentioned a number of times already that mental health needs have exacerbated during COVID time. Boston Medical Center has opened up a new site in the city. I don't remember the number of patients or bed they can they have there, but you have people who may be challenged mentally and still don't have a place to go because sometimes because of stigmatization surrounding mental health and given the demographic distribution of Brockton, a lot of people may feel may have a myth or taboo about mental health. But nevertheless, that doesn't diminish in any way the need that is there. So we continue to work with the different stakeholders, the Department of Mental Health, the regional site here in Brockton, the Behavioral Task Force, of which that we are a member of. And so, yes, we're keeping it at the forefront.
Very
Any
good.
questions, Mr. Fisk?
Yes. No, it's good that he's keeping, because that's always a concern, especially, out there in the community too. It seems like a lot of, of course I notice under the bridges and everything, it seems like there's not as many people that, are, under there, in different places lately too. So I don't know if that's that there's been things done to alleviate that.
Yes, yes. And I think the mayor is also addressing it when at different levels also
I
because
think he is too.
yeah, this is bigger than Board of Health.
Yes.
Yeah.
Yes.
All right. So then other items on the agenda, I guess. So we're still extended. We're still on the remote meeting, at least until March, according to the regulations, that we can continue to meet remotely.
Yes.
Any issue? I guess monkeypox are here. But any reported cases? Or?
Well, I'm glad to report that we have no active cases
Okay.
of monkeypox.
Okay.
And so therefore we know that it is around, but in Brockton, we have no active cases.
Right.
Beside the 3 that we've had weeks ago.
Right.
Yeah,
Okay.
so
Great.
that's a good news.
Good news. Yeah.
Yes.
There's still a vaccination center, but it's not in Brockton. It's in Brockton. The state has a website of vaccination centers for the monkeypox vaccination for those that are interested. It's on the Department of Public Health website. But the availability, I think it's a little more available now than it was initially. But for those that need the vaccination, the website gives the regional areas, the regional sites where this vaccine is available. So
Yes, and also the treatment for it or prophylaxis, if you will, is abbreviated as TPOX. So people can get that also immediately they get exposed or if they want to prevent themselves from getting it.
Right. And you've also noticed that we're the Medical Advisory Committee on the Elimination of Tuberculosis, that we since last month now have become a member of that.
Yes, the state has asked me to if I would be interested in serving on the Massachusetts Medical Advisory Committee for the Elimination of Tuberculosis. And just for my tenure here alone, I could say that we always have some cases of TB that the nurses are following, and they do DOT on them. I mean, to observe, directed observation, treatment observation.
Right.
And so therefore it gives me an opportunity to represent Brockton at the state level and to bring up any issue that we see here or that is inherent to tuberculosis, because especially with immigrants, I'm not saying that tuberculosis is an issue that immigrants bring in, but we know that treatment has been very aggressive in this country. And so therefore, we don't have people who are born in this country, we don't have as many cases. But as we people travel and people migrate to the states, to the cities, we do have cases. And so it's always there are always cases of TB that need to be followed up. So
yeah, and this is an area where the homeless population it's difficult because they're hard to find, and really you need to, George, just for your sake, this direct observed therapy. The reason for doing that is it's really important that you take the medicine, take them on time, because people can develop resistance, and then you wind up with resistant tuberculosis. So, the DOT or direct observed therapy has proven that you can keep the resistance down. And there have been outbreaks in the homeless population because of shelters and being in the shelter with other people that have it. And so it time flares up as being a major issue at time periods. There was a time, I forget when, more recently, that it was much more of an active issue, many more cases, but there's always cases around there, and it is something that important for the board and the nurses here that they have to keep track of and find patients to actually see that they take the medication in front of them. So it's labor intensive, I would say, to do that type of thing.
Yes, and so every day or every other day, I might say that the nurses have DOT with some TB cases.
Right. Okay. All right. So any other miscellaneous things?
One other issue that I would seek your advice to maybe bring that to light at the next meeting. I don't know if we want to observe a meeting on December 1st this year. I mean, that would be the last for the 2022, or what the case may be, and that would be to your discretion. But I think we've seen some issues around enforcement of tobacco laws, because the Board of Health has 3 levels of enforcement. There is the municipality, what the city officials put in place. Well, the Board of Health directors, you in concert with the municipality, but Board of Health also works with the state in order to make sure that the laws are not broken, and if there's any violation that they kept. And so therefore, the Board of Health does not have the resources to really monitor every tobacco retail stores, but the state invest in it. So therefore, working with them makes sense, because obviously we cannot go below their codes or below their ordinances or regulations, but we can go above them or we could match them. And so therefore, with the resources, I think it's a good thing that we work together. But also there is a third layer, and that is the federal, because our federal government also enforces laws regarding substances, including tobacco. And so sometimes it's become a little bit of bullying situation where you try to enforce the law, but you go with public health. But sometimes there are people who try to make decisions based on financial gains or financial guidance. So yes, we cannot ignore that there are financial decisions to be made, but first and foremost, a Board of Health cannot make decisions based on financial situations. So because we are here to enforce our public health rules and regulations, making sure that people are safe, people know how to live in the city, and what's acceptable, what's not acceptable. So I would suggest that maybe if we could include in the next meeting the agency that conducts the study or the inspection for the state, to invite them, and maybe some of the city councilors, so that we'll have we refresh ourselves of the tenure of tobacco regulations, and perhaps that would bring everyone to the same pace. And maybe we could work together. It's a request.
George, I have no problem with that. I mean,
I have no problem. I remember a couple of years ago, the state was they were going in and out of the different places, and just, we were doing some changes in regard to different tobacco products, and they were going in, and I know some people were, they got fines. And does that mean the state has stopped doing that?
No, they want to do that, but I think what I'm up against is when the state brings to light some violations. I feel that I don't have enough support in the city to enforce or to implement the violations. So sometimes it comes very difficult for me to, as a board of director, as the executive head director, to actually push to the full force of the law.
So is this because of the level of the fines or the because we years ago, part of the reason that we changed the tobacco laws, one of them was that we were getting away with some of the things we did ahead of time, was before the state actually stepped in and did it, the flavored tobacco, etc. And things that we actually stopped before it across the state became something that was removed. But the other reason was that we had more to. If you look at the population of the city and the number of licenses that we had, it was way above sort of we were way off the chart compared to other municipalities, and it put the stress on the Board of Health to have to enforce across it, and we did not have the manpower. So it was a free for all pretty much in the city because we couldn't do it. The state has come in now and is doing a lot of the enforcement stuff, but they have certain rules, George, in place, and
Yeah.
you know, when they find people, they find them, and we're supposed to execute against that. And I think there's some pushback because of that. So I think that at least is my understanding of some of the problems that exist. And the people have to recognize that, you know, the regs are set. These are not regs that the Board of Health said this is the state has put these things in place, and it's up to the board to enforce them. And sort of you're caught in the middle of hands being fined and pushed back about what has not been a decision, I think, from the board. It's been from the state for
Yes.
doing the enforcement.
Right.
Yeah, yes. For example, the state fines $1,000 for first violation of a store selling to underage people under 21. So that's $1,000 for the first fine, and then the second violation is $2,000. The third violation is $3,000. So it goes in crescendo. And then if you look at it, aside from that, there is also a suspension of the license. So which means that when there is a violation and the state goes out, they take note of it, and then they inform us. Basically, we need to find how to make the business comply with the violation. I mean,
Now, where does the money go? If that $1,000, is that going to Brockton or is it going to the state?
No,
when they come in
to Brockton.
Okay.
Because once they do the fine, when the state imposed the fine, basically we would be, I mean, the next step for us would be to send the letter of the violation, and then the business can respond by either going to City Hall directly to the city clerk and pay the fine, or they can come here, but the money would be collected. Even if it is collected here, it goes to the city treasury.
Yes. So if there's issues, yes, we can bring this on to the agenda from the next.
We can talk about it.
Yep. Absolutely.
Yep.
Thank you.
Great.
Thank
Okay.
you.
Any other issues, Mr.
I've
Fisk?
got none here. No.
Okay, great. So with that, our next meeting of the Board of Health will be Thursday, December 1st, and we'll plan to have some discussion about the tobacco enforcement laws here in the city. And other than that, I entertain a motion to adjourn.
Yep. I make a motion that we adjourn the meeting until
All right.
next one.
All right. So the meeting is adjourned. Thank you, everyone. Have a happy holiday. Stay safe.
Same to you all.
Enjoy your Thanksgiving. All right. And we'll meet again in December.
Take care.
Take care.
Thank
Bye-bye.
you.
Bye-bye.
Thank you.